Are there medications for both PTSD and ADHD? Are there medications for both post-traumatic stress disorder and attention deficit hyperactivity disorder? Yes, there are medications that can be used to treat both conditions, but managing them together requires careful thought. Each disorder has its own unique neurobiological features and symptoms that can overlap. For post-traumatic stress disorder, or PTSD, the main medications recommended by health authorities include selective serotonin reuptake inhibitors, known as SSRIs, like sertraline and paroxetine. Another class of medications, serotonin-norepinephrine reuptake inhibitors, or SNRIs such as venlafaxine, is also commonly used. These medications help target neurotransmitters that play a role in fear and anxiety, and they have strong evidence supporting their effectiveness in reducing PTSD symptoms. However, it is important to note that trauma-focused psychotherapies are considered the first-line treatment for PTSD. Medications are typically used when therapy is not available, feasible, or preferred by the patient. On the other hand, attention deficit hyperactivity disorder, or ADHD, is often treated with stimulant medications, including methylphenidate and amphetamines. These medications work by increasing dopamine and norepinephrine activity, which helps improve attention and executive functioning. There are also non-stimulant options like atomoxetine, which is a selective norepinephrine reuptake inhibitor. When PTSD and ADHD occur together, treatment can become more complicated. Some studies suggest that medications used for ADHD, including stimulants and atomoxetine, may also help alleviate PTSD symptoms in certain cases. For instance, there has been a case study where atomoxetine improved chronic pain and cerebral blood flow in a patient with both PTSD and ADHD, indicating some potential overlap in treatment benefits. Additionally, small studies have shown that stimulant medications for ADHD might reduce PTSD symptoms, although this evidence is still preliminary and requires further investigation. Since PTSD and ADHD share overlapping symptoms, such as difficulties with attention, restlessness, and challenges with executive functioning, it is crucial to accurately distinguish and treat both conditions. Screening for ADHD in patients with PTSD is important, as addressing ADHD symptoms can enhance overall functioning and may even help with some PTSD-related difficulties. In summary, PTSD medications primarily include SSRIs and SNRIs, with trauma-focused therapy being the main treatment. ADHD medications consist of stimulants like methylphenidate and non-stimulants like atomoxetine. Some ADHD medications may have a positive effect on PTSD symptoms, but the evidence is limited and not definitive. Treatment plans should be personalized and supervised by healthcare professionals, keeping in mind the potential benefits and risks of medications for both conditions. More research is needed to establish clear guidelines for treating individuals with both PTSD and ADHD. If you or someone you know is experiencing symptoms of either condition, it is essential to seek a comprehensive evaluation and treatment from qualified mental health providers. This ensures safe and effective management tailored to individual needs.